What is ulcerative colitis? Ulcerative colitis is a chronic inflammatory bowel disease, also known as IBD. It primarily affects the large intestine or the colon. This condition leads to inflammation and the formation of sores, called ulcers, in the lining of the colon. These ulcers can bleed and produce pus and mucus. Although ulcerative colitis is a lifelong condition, proper management can allow individuals to experience long periods of remission. This disease is not contagious and does not directly cause colon cancer, but long-term ulcerative colitis can slightly increase the risk of developing colon cancer. However, this risk can be reduced through regular screening and diligent management of the condition. Understanding the basics of ulcerative colitis is crucial for those affected, empowering them to take an active role in managing their health and seeking appropriate care. If you suspect you may have ulcerative colitis, it is essential to consult a healthcare professional for an accurate diagnosis and a personalized treatment plan. The mechanics of ulcerative colitis. Ulcerative colitis occurs when the body's immune system has an abnormal response. Instead of just attacking foreign invaders like bacteria and viruses, it also attacks the lining of the colon. This immune system malfunction leads to chronic inflammation and the formation of ulcers. The exact cause of this immune system misfire is unknown, but researchers believe that a combination of genetic predisposition, environmental triggers, and gut microbiome imbalances may play a role. Understanding the underlying mechanisms of ulcerative colitis is key for developing effective treatments that target the root cause of the disease. This involves ongoing research to uncover the complex interplay between genetics, the immune system, and environmental factors. The ultimate goal is to find ways to modulate the immune response and prevent the damaging inflammation that characterizes ulcerative colitis. By unraveling the intricacies of this complex disease, researchers hope to develop more targeted and effective therapies for those affected by it. Causes and symptoms. Untangling the complexities. The exact causes of ulcerative colitis remain elusive, but research suggests a multifaceted interplay of factors. Genetics plays a role, as individuals with a family history of the disease are at increased risk. Environmental triggers such as diet, stress, and infections can also contribute to its development. The gut microbiome, the trillions of bacteria residing in our intestines, is also believed to be involved. Imbalances in the gut microbiome, known as dysbiosis, may disrupt the delicate balance of the immune system, leading to inflammation in the colon. Symptoms of ulcerative colitis can vary in severity and duration, ranging from mild to debilitating. Common symptoms include abdominal pain and cramping, persistent diarrhea often accompanied by blood or mucus, rectal bleeding, urgency to defecate, and a feeling of incomplete evacuation. Other symptoms may include fatigue, loss of appetite, weight loss, and fever. Recognizing the warning signs. Symptoms of ulcerative colitis. The symptoms of ulcerative colitis can be unpredictable, ranging from mild discomfort to severe flare-ups. Recognizing the warning signs is crucial for early diagnosis and effective management of the condition. One of the most common symptoms is persistent diarrhea, often accompanied by blood or mucus in the stool. This is a result of inflammation and ulceration in the colon, which disrupts the normal digestive process. Abdominal pain and cramping are also prevalent, varying in intensity from a dull ache to sharp stabbing pain. The location of the pain can also vary, but it is often concentrated in the lower abdomen. Rectal bleeding is another hallmark symptom, ranging from small streaks of blood in the stool to heavier bleeding. This occurs when the ulcers in the colon bleed. Individuals with ulcerative colitis may also experience an urgent need to defecate, even if their bowels are empty. This urgency can be accompanied by a feeling of incomplete evacuation, as if they are unable to fully empty their bowels. These symptoms can significantly impact quality of life, making it challenging to engage in daily activities. Section 5. Diagnosis. Unveiling the mystery of ulcerative colitis. Diagnosing ulcerative colitis involves a comprehensive evaluation to rule out other conditions with similar symptoms. A thorough medical history and physical examination are the first steps. Your doctor will inquire about your symptoms, family history, and any previous medical conditions. Blood tests may be ordered to check for signs of inflammation, anemia, or infection. Stool samples are analyzed to rule out infections and assess the presence of blood or other abnormalities. Imaging studies, such as colonoscopy, are essential for visualizing the colon and obtaining biopsies. Colonoscopy allows the doctor to examine the entire colon using a thin, flexible tube with a camera attached. Biopsies, small tissue samples, are taken during the procedure and examined under a microscope to confirm the diagnosis. In some cases, other imaging tests, such as a CT scan or MRI, may be recommended to assess the extent of inflammation or rule out complications. Section 6. Treatment options. Navigating the path to relief. Treatment for ulcerative colitis aims to reduce inflammation, manage symptoms, and promote long-term remission. The specific approach depends on the severity of the condition and the individual's response to treatment. Medications are the cornerstone of ulcerative colitis management. Aminosalicylates are often the first line of treatment, helping to reduce inflammation in the colon. Corticosteroids, such as prednisone, are more potent anti-inflammatories used for moderate to severe flare-ups. Immunomodulators, such as azathioprine and 6-mercaptopurine, suppress the immune system to control inflammation. Biologics are a newer class of medications that target specific proteins involved in the inflammatory process. These medications, such as infliximab and adalimumab, are typically reserved for individuals who haven't responded to other treatments. Surgery to remove the colon and rectum, known as proctocolectomy, is an option in severe cases or when medications fail to provide adequate relief. Section 7. Living with ulcerative colitis, a journey of resilience. Living with ulcerative colitis is an ongoing journey that requires adaptation, resilience, and a proactive approach to managing the condition. While there is currently no cure, individuals with ulcerative colitis can live full and meaningful lives with the right treatment and lifestyle modifications. It's important to remember that ulcerative colitis affects each person differently, and what works for one individual may not work for another. Working closely with your healthcare team to develop an individualized treatment plan is crucial. This plan may include a combination of medications, dietary changes, stress management techniques, and regular monitoring. Lifestyle modifications play a vital role in managing ulcerative colitis. Maintaining a healthy diet that is low in processed foods, sugary drinks, and unhealthy fats can help reduce inflammation and promote gut health. Identifying and avoiding trigger foods that exacerbate symptoms is also essential. Regular exercise can improve overall well-being, reduce stress, and promote regularity. Section 8. The importance of support and understanding. Living with a chronic condition like ulcerative colitis can be challenging, both physically and emotionally. It is essential to have a strong support system in place to provide encouragement, understanding, and practical assistance. Family and friends can play a vital role in providing emotional support, helping with daily tasks, and accompanying individuals to medical appointments. Support groups and online communities offer a safe and supportive space for individuals with ulcerative colitis to connect with others who understand their experiences. Sharing stories, coping strategies, and information can empower individuals and reduce feelings of isolation. Mental health professionals, such as therapists or counselors, can provide coping mechanisms for managing the emotional and psychological impact of living with a chronic illness. They can help individuals develop stress management techniques, address anxiety or depression, and improve their overall quality of life. Remember that seeking support is a sign of strength, not weakness. It is crucial to prioritize your well-being and reach out for help when needed. Section 9. Your journey to wellness. Navigating the complexities of ulcerative colitis can feel overwhelming at times, but remember that you are not alone. By taking an active role in your health, seeking support, and embracing lifestyle modifications, you can live a full and meaningful life despite the challenges. Remember that every individual's journey with ulcerative colitis is unique, and there is no one-size-fits-all approach. Working closely with your healthcare team, staying informed about the latest research and treatment options, and listening to your body are essential for optimal management. Embrace a holistic approach to wellness that encompasses physical, emotional, and mental well-being. Prioritize self-care, manage stress, and engage in activities that bring you joy. Remember that you are your own best advocate. By staying informed, seeking support, and making empowered choices, You can navigate the challenges of ulcerative colitis and live a fulfilling life.